Good evening, everyone. My name is Angela Moy. I'm the USANA Silver Director, and I'm also a licensed acupuncturist, a registered nutritional health specialist, and I'm also a pharmaceutical consultant. Tonight, I want to thank Dr. Linda for giving me this opportunity to share with you the female health. Initially, I was planning to present both the male and the female health, but due to the time limit, I will focus on women tonight. I will make another presentation for the gentleman next time. So as a disclaimer, there are some anatomical pictures tonight that may be offensive to some people. So this seminar is for educational purpose only. We want to let you understand the female body parts, the common diseases related to the women, and the nutrition to improve the woman's health. So our aim is to help you to have a healthy and happy life. So there are many health issues related to women. Tonight, I will focus on the menopausal symptoms, the breasts of the woman, and the health for pregnancy. So before I start, I want to show you some common women health issues. Due to the woman body parts, women have gynecology disorders and pregnancy issues. Some common gynecology disorders such as menstrual pain, heavy menstruation, no menstruation, urinary tract infection, fibroids, vaginitis, pelvic inflammatory disease, and endometriosis. So this is the endometriosis is a painful disorder when the uterus lining grows outside of the uterus. And this also causes infertility disorder. There are pregnancy issues such as nausea, vomiting, miscarriage, stillbirth, premature labor, sudden infant death syndrome, breastfeeding issues, and birth defects. There are also infertility disorders such as uterine fibroids, polycystic ovary syndromes, the PCOS. PCOS is a hormonal disorder. The women with PCOS may have infrequent or prolonged menstrual periods or excess male hormones, androgens. The ovaries may develop some fluid pouches, and the ovaries fail to release the eggs. So that's the PCOS. And endometriosis, which I mentioned as gynecology problem, it is also under infertility because if the uterus lining grows outside of the uterus, it may cause infertility issues. And there are also primary ovary insufficiency. This is when a woman's ovaries stop working normally before she's 40 years old. And if she does not have enough eggs in the ovaries for fertilization, and this will cause infertility. And there are other women's diseases such as ovary cancer, cervical cancer, breast cancer, and menopausal symptoms such as mood swings and hot flashes. So here are some of the, here is the woman reproductive system. This slide is actually showing a very complicated female reproductive system. So on the left side here, you see the body starting from the brain to the lower parts, the abdomen, with the uterus, the ovaries, and the vagina. And on the right side, I expand this part here. I show a big uterus, the ovary, and the fallopian tube. I put these two pictures side by side because the woman reproductive system actually starts from the brain, the endocrine system, the nervous system, and to the abdomen. So going back to the body side, in the brain, we have the hypothalamus. This is inside the brain. It controls the hormones, which will start the ovulation and the menstruation process for women. So when a girl reaches about 12 to 14 years old, the hypothalamus here produce a hormone called gonadotropin releasing hormone. So this hormone will give a signal to the pituitary gland, which is also inside the brain. So the pituitary gland will produce a hormone called follicle stimulating hormones. So this hormone will send a message down to the ovaries to trigger the eggs to be produced down here. So our nervous system is actually sending this message from the head to the abdomen. When the eggs begins to mature inside the ovaries, now I'm going to this part, more hormones are produced, such as estrogen. When the estrogen reaches a certain level, it will send another message back to the hypothalamus up here. The hypothalamus will send another gonadotropin releasing hormone to the pituitary gland to release another hormone called the luteinizing hormone. And this luteinizing hormone will send a message to the ovaries to release the mature egg. So this is called ovulation. So the egg is being released from the ovaries. When the egg released from the ovaries, they will move through the fallopian tube. This is the fallopian tube. And if there are sperms in this area at this time, they can fertilize the eggs here. But if there is no sperms around, the mature egg will be a waste. It will be eliminated. Now going back to the egg. So it will continue to mature. The hormones will continue to release, message coming from here. More hormones continue to release, such as estrogen and progesterone. So these hormones will make the uterus, here the uterus, the lining thicker, so that if the eggs get fertilized, it will have a place to settle. The purpose of getting a thick uterus lining is to prepare the endometrium lining inside the uterus for pregnancy. So this is like preparing a farmland. So when a seed implant into the farm, and if the quality of the seed is good, and if the quality of the ground is good, a tree or a plant can be grown. However, if the quality of the seed is not good, or if the ground is not fertile, the tree may not grow. And that's why we have infertility or miscarriage issue if this area is not healthy. If there is no sperm to fertilize the egg here, the levels of estrogens and progesterones will decline. So without the high level of hormones to help maintain the uterus lining, the thick lining here will start to break down and the body sheds the lining. So this is the shedding of the lining is the start of the menstruation cycle. The woman will have a period. So the period is made up of the shed lining of the uterus. So this is a very complicated process inside a woman. And the timing of the sperms meeting the eggs, the health of the uterus, the sperms and the eggs, the quality of the hormones released at this time, all these factors will affect the outcome of whether an egg can be fertilized and a baby can be created. If no fertilization happen at this time, periods and menstruation will follow. So every part of the reproductive system, from the brain, the hypothalamus, the pituitary gland, the nervous system sending the hormone messages down to the abdomen, the movement of the eggs from the fallopian tubes to the uterus, the muscle inside the fallopian tubes moving the eggs and the sperms, and the settlement of the fertilized eggs on the endometrium lining of the uterus. All this require transferring of nerve impulses, making and moving of hormones, sending of nutrition, circulation of blood, and also waste removal from the female reproductive system. So this is a very complicated process. But I haven't finished yet. So I'm still talking about women. So when the woman getting to about 50 years old, the ovaries here start aging So less hormones are produced. So the follicle stimulating hormones and the neutralizing hormone can estrogens and progesterone and testosterone. So perimenopause and menopause will start. We don't consider menopause and perimenopause as diseases because they are the natural process of a woman's life. But these changes in the hormones and natural decline of estrogen levels during menopause can significantly affect the health of the woman. So estrogen level decrease in menopause and after menopause, and this may contribute to night sweats, hot flashes, which often disrupt the woman's ability to sleep. So all the hormones ups and down here during menopause will affect the brain as well, because they are all connected, as you see. And it will affect the body, like you may get dry skin, you may be losing your hair. So after finishing with the abdomen, I want to move to the breasts. So this is another area where women have certain different criteria. Even both men and women have breasts, but women have more hormones that affect the breasts. You can see from this picture that there are fats, there are muscles, blood circulation, milk ducts, and lymph vessels in the breast area. So after puberty, the woman mammalian glands are influenced by female hormones, and the breast will grow. So besides physical health, the woman's breasts also bear the image of health and beauty. So from this picture, you can see that the breasts are very close to the lungs and the heart. See, the heart is here. And any issues in the lymph glands and blood vessels in this area can cause problems to the heart and the lungs as well. While there are breast cancer, the tumor cells from the breast can cause problems to the heart, which will pump blood to the other parts of the body, like the brain, the lungs, the liver, and the bones, etc. So any health issues with the breast may cause problem to other parts of the body. So we don't have time tonight to discuss any further. So Dr. Linda may plan more training in the future on other women's health issues, such as breast cancer, the PMS, the infertility, or other health issues. So as I have mentioned before, the breast and uterus are made up of cells, blood vessels, lymph vessels, muscles, and tissues. So if the cells here for the breast and the uterus are not well nourished, there may be toxins built up in this area and cause problem in this area, such as poor lactation after delivery, breast lumps, and breast cancer. So for the uterus part, if they don't have enough nutrients and blood circulation, they can have blockages and buildup of tissues. And this may cause uterine fibroids, endometriosis, uterine cancer, and infection, even infection of the vagina, etc. So as you have seen in previous slides, there are many arteries and veins, lymph nodes, and tissues in the woman reproductive system. We need to supply them with proper nutrition to ensure that they are healthy. So the basic nutrition to improve the immune system of the whole reproductive organ, I would highlight the Health Pack, which gives a comprehensive balance of antioxidants, vitamins, and minerals for the whole body. The pro-glucamide, which supports the healthy immunity even during times of occasional stress. The probiotics here contribute to a natural healthy gut flora to benefit digestion. I also have Biomega, which supports cardiovascular health cognitive health, and brain function. The propionol C100 or C200s provide antioxidants to defend and protect the body. So for menopausal women, I will spend more time to talk about their health needs. So there are issues that are related to the menopausal woman, and there are changes such as they will have irregular menstrual cycles before the menopause. This is called the perimenopause period. And during this time, they can have hot flashes, night sweats, and which make them very uncomfortable. They also have mood changes, they get irritable, and they get upset easily. So if they don't have a good sleep, they get tired, exhausted, and they have insomnia. And they may have a lot of dreams during this time. Because they don't have good sleep and they are not happy, it affects their whole body. They may be losing hair, and the skin may start to show wrinkles at this time. If there is not enough blood going to the head, they can be dizzy and headaches. If they don't have good metabolism, good digestion, they may gain weight. There may be allergies to new stuff. They may have irregular heartbeats. They may forget things and lack of concentration. So these are a lot of the changes in the woman's life during menopause. USANA has a new product that is aiming at helping women going through perimenopause and menopause. The product is called AstroPro, and this is a new product. This is a plant-based product for menopause support to ease symptoms in healthy women. It provides gentle relief from commonly experienced symptoms such as hot flashes, night sweats, and mood swings. Since AstroPro is a plant-based, it provides phytoestrogen. That means plant-based estrogen that is similar to the estrogen in our body. And it will communicate with the estrogen receptors in the body to help with the well-being during menopausal activities. It supports the normal and healthy function of hormones in women. The key ingredients in AstroPros red clover, soy isoflavones, flaxseed extracts, and licorice root extracts. And according to the label, they recommend to take 2 tablets per day. And these natural derived ingredients are gentle and effective because they function as mild phytoestrogens, and they are similar to estrogens found in plants. With regular use, AstroPro can improve the quality of life during this transition to menopause and the years following. That means women can take them after menopause to maintain the health and hormonal changes. To give you a better picture, I have listed each key ingredients in AstroPro for your reference. The soy isoflavone extracts, this one will benefit certain menopausal symptoms such as hot flashes, also prevent osteoporosis, help to reduce your insomnia and mood swings. The red clover isoflavone extracts, this one will benefit certain menopausal symptoms such as hot flashes. This one can also benefit the skin, can improve sleep, and stabilize the moods. The flax seeds, this one is the phytoestrogen, the plant estrogen. This is similar to the hormone estrogen in our body. So this one contains soluble fiber and essential omega-3 oil and antioxidants and proteins. It can reduce constipation, improve diabetics, high cholesterol, heart disease, cancer, and several other health conditions. The last one is licorice. This is the anti-inflammatory and immune-boosting properties of licorice that also help soothe the gastrointestinal problems It will speed up the repair of the stomach lining and restore balance in case of food poisoning, stomach ulcers, and heartburns. And this also has a unique function on the serotonin system, suggesting potential benefits on mood swings during menopause. So after menopause, I would like to talk about health in preparing, during, and after pregnancy. So when a woman gets pregnant, you can see that the baby is growing inside the body. So she need to supply oxygen, nutrients, and hormones to the baby. So the baby digests the nutrients and grow inside the mother, and also produce waste. So the waste and the carbon dioxide from the baby will be eliminated through the mother. So the mother needs to remove the waste and the carbon dioxide from the baby through her liver, her kidney, and her urinary bladder. So the basic supplements for the mother to do all this work, I would recommend Prenatal Essentials from USANA. It has the vital antioxidants and core minerals, and also the magnesium, calcium with vitamin D, the MagniCal, and the vitamin D and Biomega. This is a set for preparing during and after pregnancy. So getting into a little bit more details about the prenatal essentials, this provides the optimal levels of all required vitamins, minerals, trace elements, and other micronutrients to the mother. So based on the design of this formulation, each ingredient is at its best tolerated and most easily assimilated form. So from the prenatal core minerals bottle, this is very important. It contains what's important for a healthy pregnancy baby. It has 3 times the amount of magnesium as compared to other generic prenatal supplements. The magnesium helps support the normal fetal development. They also have the high potency iodine, which is critical for healthy neurocognitive development. So this is good for the brain and the mental development for the baby. It also has excellent source of iron. When the baby is growing inside the mother, the baby needs a lot of blood and nutrients. The iron is required to meet the high demand of red blood cells and ensure the baby has enough stores of iron needed during the first month of life. So this is another bottle called Prenatal Vital Antioxidant bottle. This one contains a carefully formulated range of high quality vitamins. It provides 600 microgram of folic acid. Folic acid is important during pregnancy to support healthy fetal neurocognitive development. So this is again for the brain and the nervous system. This is also has a good source of vitamin A from beta carotene. Vitamin A supports the development of the heart, the limbs, and the lungs, and the respiratory system, and other areas. It also contains biotin, which is required for the DNA replication for different kinds of cells growing inside the body. It also supports healthy skin, hair, and nails. So I have finished talking about the health support for a pregnant woman. I also want to talk about the health of the breast. So here are some foods that are suitable for prevention of breast cancer. Remember, the breast contains muscles, fats, milk ducts, lymph vessels, and lymph nodes, and blood vessels. So the breasts are also close to the heart and the lungs. It is important to keep the breast healthy and to prevent cancer. So I will talk about some of the food on this page, such as the berries. The berries has a lot of antioxidants, and they are high in fiber and may help fight inflammation. They are good for the skin and may help protect against cancer. The beans are excellent source of dietary fiber. vitamin B, and many other vitamins and minerals. They can help reduce blood sugar, improve cholesterol levels, and help maintain a healthy gut. Broccoli, this is great product. This is a great source of vitamin K and C, a good source of folic acid also provide potassium and fiber. It helps form body tissues and bones and help healing cuts and wounds. And cauliflower is also good. It has high in fiber and vitamin K. It provides antioxidants and phytonutrients that can help protect against cancer. It also contains fiber to enhance weight loss and digestion. It has choline that is essential for learning and memory. Now I want to talk about garlic. We have been talking about the medicinal benefits of eating garlic. Garlic is low in calories and rich in vitamin C, B6, and manganese. And some researchers suggest the sulfide content from garlic can help prevent cancer. Garlic also has antioxidants to boost the immune system, reduce high blood pressures, keep cholesterol in check, and increase mental alertness. Ginger, like garlic, also contains powerful medicinal properties. It has anti-inflammatory effects. It also treats many forms of nausea, especially morning sickness. Again, green tea, we have also heard about the medicinal effects of green tea. It protects against heart disease, lower blood pressures, and bad cholesterol. Some researchers have suspect that green tea, the catechins inside, have the ability to block cancer-causing free radicals. So there are other foods that help prevent breast cancer, like kale, olive oil, peaches, parsley, plums, wild salmons, and walnuts. So in order to maintain a healthy body, we need to have the macro and micronutrients for our body. USANA supply both the macro and micro products for our body. And I'm going to mention some of the micronutrients. The health pack I mentioned before, it provides a full daily dosage of vitamins, core minerals, and also magnesium and calcium, and an exclusive Cellsentials antioxidant booster. The prenatal Cellsentials is a comprehensive supplement designed for pregnant women and the developing babies before, during, and after pregnancy. The Biomega supports sound cardiovascular health, cognitive health, and brain function. The Magnical D is a comprehensive formula with equal proportions of calcium and magnesium, and it also has vitamin D. They help in the development and maintenance of bones and health. The Happa Plus supports the body's natural detoxification process. Digestive enzyme supports the healthy digestion. Provironol C100 and C200 provides antioxidants, defense, and protection for the maintenance of good health, good blood circulations, and good skin. Active calcium chewables, they support bone health. Glucosa supports joint health by maintaining healthy cartilage, and they also help with improving the skin. Vitamin D helps in the development and maintenance of bones and teeth. This is also a sunshine vitamins. This is a happy vitamins to improve our mood. USANA probiotics contributes to a natural healthy gut flora to benefit health and also help our digestion. So as a summary, this is the nutrition that I have presented to you. And also there are 5 key ways to health and healing. First, we mentioned about the proper nerve supply. Remember I talked about how the brain controls the whole body. So this is providing proper nutrition to the brain, have positive thinking, ensure the nervous system is properly nourished. We'll also need to do regular exercise to move the blood and oxygen inside the body to help you control your weight, improve your mental health and mood, and help keeping you thinking, learning, and judgment. Keep making your judgment skills as sharp as you age. Nutrition, we already said a lot about nutrition. So good nutrition improve our overall well-being and maintain our immune system to prevent getting sick. And our body detox and rejuvenate during our sleep. So have enough sleep can reduce stress, reduce inflammation, improve our memory, make us more alert, and can help prevent cancer. Finally, we need to relax. So you can decide whether you want to pray or not. But praying and meditating can help to regulate our heartbeat, make it stronger and less stress. This is a mental and spiritual activities. But praying has been shown to speed up the recovery of the heart following heart attacks and cardio surgery. So tonight, I've shared with you the health issues of women and some of the ways to improve women's health. Hope they are helpful. And next time, I will talk about the health for men. Thank you and good night.